We are at file item 42, ACR 259 by Mr. Gallagher. The clerk will read.
Assembly Concurrent Resolution 259 by Assemblymember Gallagher and others relative to Pediatric Acute Onset Neuropsychiatric Syndrome PANS Awareness Day.
Mr. Gallagher.
All right, thank you, Mr. Speaker and members. Today I'm proud to present ACR 259, which designates October 9th as PANS Awareness Day. Pediatric Acute Onset Neuropsychiatric Syndrome, PANS, is an autoimmune disorder that, if left untreated, results in devastating symptoms. During an infection like strep throat, antibodies will mistakenly begin attacking parts of the brain. Just days later, children can have a dramatic onset of neurological symptoms like obsessive compulsion, aggression, and anxiety. It is often misdiagnosed as a psychiatric disorder like Tourette's, and due to the lack of research and awareness, which can lead to an inadequate treatment and debilitating illness. Through the efforts of families affected, PANS has recently been established as a distinct diagnosis, but there is still a lot of research to be done and a lot of work ahead of us. It starts with spreading awareness of PANS and ensuring that people are trained, that doctors are trained to recognize this unique and rare disease. Thank you. I ask that we recognize PANS Awareness Day in this legislature. Thank you.
Thank you, Mr. Gallagher. Mr. Levine, you are recognized.
Thank you very much, Mr. Speaker and members. I also rise in support of ACR 259, which recognizes October 9th, 2018 as Pediatric Acute Onset Neuropsychiatric Syndrome, or PANS Awareness Day here in California. Like the other nearly 7,000 diseases and conditions considered rare because they affect fewer than 200,000 Americans, PANS sufferers are often misdiagnosed and are given treatment that do not address the underlying infection. Members, thousands of Californians suffer from rare diseases, and it is because they are so rare, this rarity, that they are often conflated with more common diseases that cause similar symptoms. Without proper diagnoses and appropriate treatment, PANS can result in debilitating conditions that have a significant impact on the lives of those affected. By raising awareness about these rare diseases, patients, caregivers, and medical professionals can better recognize the signs and symptoms of PANS and ensure that the nearly 1% of pediatric population in the U.S. suffering from PANS receives the proper and necessary treatment. I thank the author for bringing this resolution forward, and I respectfully request an aye vote.
Thank you, Mr. Levine. Seeing no additional discussion or debate, Mr. Gallagher, would you like co-authors on the resolution?
Yes, Mr. Speaker, I'd like to leave it open for co-authors, and I thank my colleague from Marin for joining in this in support for this resolution.
Great. Thank you, Mr. Gallagher. Members, the first roll will be open for co-authors on the resolution. Members, this is co-authors. Clerk will open the roll. Members wishing to add as co-authors, this is co-authors on ACR 259. This is for co-authors. Clerk will close the roll. There are 65 co-authors added, and without objection, we may take a voice vote on the resolution. All those in favor say aye. Aye. Opposed, say nay. The ayes have it. The resolution is adopted. And Mr. Gallagher, back to you for your special guest introduction.
Thank you, Mr. Speaker. In the gallery today, we have Dr. Russell Shapiro. Dr. Shapiro was someone who's helped make me aware of PANS and this debilitating disease, and he shared with me his story of his daughter who has PANS and went through this, and the struggles that their family went through in ensuring that she was diagnosed properly. Since that diagnosis, Dr. Shapiro has formed a grassroots effort, CalPans, to raise awareness, support research, and advocate for legislation to support families and children with PANS. I'd like to recognize him in the gallery, Dr. Shapiro.